You are almost done with the e-learning course program. In the last days, the lectures and workshops taught you the case management process specific to the realities of 4Ps through Kilos-Unlad. It also taught you the tools and the skills in working with your respective household beneficiaries. Now that our training is almost done, let us now discuss your team's role in the pilot testing. In this video, you will be oriented on your specific tasks for the pilot testing. Let us begin in the session objectives. Number 1, introduce the composition of the KU pilot testing team. Number 2, provide a clear definition of each member's functions, roles, and responsibilities. Number 3, discuss the importance of each role and responsibility to achieve the pilot testing goals and objectives. And number 4, understand the business process to connect the role of each member with each other. Let me first introduce the Kilos-Unlad Case Management Pilot Testing Team composed of 8 members. City or Municipal Link or Community Facilitator, Social Welfare Officer 2, Social Welfare Officer 3, Institutional Partnership Development Officer, Provincial Link, Regional Gender and Development, Indigenous Peoples or Modified Conditional Cash Transfer Focal Persons, and Regional Case Management Focal Person. The team will be headed by the Regional Program Coordinator as the operationalization mentor with the specific roles. Number 1, participate in the scheduled e-learning course program together with the respective regional pilot testing team to gauge the team's learning progress and concerns and guide them in laying out the plan for KU pilot implementation. Number 2, he or she shall act as the overall in charge in the regional pilot testing to monitor the progress of implementation in close coordination with the Regional Case Management Focal and Regional Gender and Development Officer and conduct monthly consultation with the regional pilot testing team to provide the team's technical support and guidance. While for the e-learning course rollout, he or she shall ensure the conduct of KU e-learning course rollout to the case management teams such as the City or Municipal Links, Community Facilitator, SWO2s, SWO3s, Provincial Links and other related RPMO and POO staff, especially those who have exiting targets, in collaboration with the regional training specialist, and provide technical assistance, coaching, and mentoring to the regional pilot testing team during the e-training rollout. Let me introduce to you the specific role of each member. Number 1, the City or Municipal Link or Community Facilitator, as the case managers will be the primary actor in KU pilot testing and user of KU tools for data gathering, assessment, and analysis and translation of results to concrete intervention plans and monitoring of the progress of implementation. Number 2, the Social Welfare Officer 2 will establish and maintain a monitoring system to track the pilot testing implementation progress in collaboration with the Provincial Link. 3, as the case supervisor of the case managers, will provide technical assistance, coaching, and mentoring to the case managers. He or she shall also monitor the pilot implementation, both in experimental and comparison groups, and augment medium to high-risk cases, especially to those who are non-social work graduate or non-registered social workers. Number 4, the Institutional Partnership Development Officer, as the Institutional Partnership Officer for LGU, shall assist the Provincial Operations Office and Municipal Operations Office in engaging the LGUs for the deliverables stated in the networking and convergent complementation of programs and services. Number 5, the Provincial Link will ensure the smooth KU pilot test implementation, monitoring, recording, and reporting in collaboration with other provincial technical staff such as the Provincial Monitoring and Evaluation Officer, IPDO, Systems Focal Persons, etc. Number 6, the Regional Gender and Development Focal Person as co-facilitator in the monitoring of KU pilot test in both experimental and comparison group will ensure that safeguard measures and protocols are in place and aim to protect the welfare of the household beneficiaries involved in the pilot testing and provide necessary technical assistance to case managers, SWO2s, SWO3s, IPDO, and Provincial Links. Number 7. The Indigenous Peoples or Modified Conditional Cash Transfer Focal Person shall ensure culturally appropriate and gender-sensitive consultation processes in engaging tribal leaders, Indigenous community, and IP representatives, most especially in selected IP areas for community organizing. And number 8, the Regional Case Management Focal Person will provide necessary technical assistance, coach and mentor the case managers, SWO2, SWO3, IPDO, and PL as data analysts prepare, review, and consolidate the progress report and overall KU pilot implementation, including the documentation of good practices that emanate during the implementation. And lastly, the Regional Case Management Focal shall ensure timely submission of report to NPMO using the prescribed template and timeline. The city or municipal links as case managers handling household level, groups, and communities have to perform the case management tasks along with the preparation of reports such as case inventory, monitoring or updating of case development, progress notes, etc., guided by the tools that were discussed in the previous modules. The SWO2 shall review and monitor the development of the reports mentioned above prepared by the case managers and track the pilot testing implementation progress. The SWO3 as case supervisor to the case managers may also augment to manage complicated cases, especially to those who are non-social workers, and facilitate case conference to the beneficiaries with complicated cases that were discussed in the case referral pathways, handling special and difficult cases. The IPDO will also play a crucial part in the pilot testing process by lobbying support from the LGUs, NGOs, and other partners, particularly in networking and convergent complementation of programs and services. He or she is also expected to work closely with the case managers to link the household level, groups, and communities to avail necessary programs and services based on the assessment. The Provincial Link as the overall in charge in the operationalization of KU pilot testing at the provincial level must ensure the smooth implementation of the activity, including monitoring the progress, complete recording and documentation of the whole process, along with his or her designated provincial technical staff. The Provincial Link shall sit with the pilot testing team meeting, coaching and mentoring for technical assistance. Also, the PL shall ensure that the pilot testing report is reviewed and timely submitted to the RCM focal person. The RGAD focal person as co-facilitator in monitoring KU pilot testing shall ensure safeguard measures to protect the welfare of the household beneficiaries, expected to collaborate and provide technical assistance to the case managers along with the pilot testing team. The IP and MCCT focal persons as co-facilitators in monitoring KU pilot testing shall ensure that the process is IP culturally and gender sensitive. They are expected to collaborate and provide technical assistance to the case managers and the pilot testing team. The RCM focal person as overall in charge in the regional KU pilot testing shall closely collaborate with the RPC to initiate the conduct of technical assistance, coaching and mentoring sessions to the case managers along with the pilot testing team. He or she will collaborate with the PL to ensure smooth implementation of pilot testing. Activities are completely documented with data analysts and timely submission of the report to NPMO using the prescribed template and timeline. To achieve the pilot testing goals and objectives, we have a structure or body that was formed. Tasks were also put in place. The KU pilot testing aims to guide the 4Ps case managers in the case management strategy as applied in working with individuals or families, groups, and communities within 6 months in preparation for full implementation by the calendar year 2021. The DSWD Central Office KU Technical Working Group was tasked to lead in providing tactical inputs and recommendations for the development, planning, implementation, and evaluation of the KU field testing. They will provide technical guidance for finalization and eventual adoption and institutionalization of KU. The Gender and Development Unit of the Pantawid Pamilya National Program Management Office was tasked to oversee and monitor the KU field testing implementation. They would also provide technical assistance to the KU field implementers through spot visits or electronic monitoring, develop case management tools, consolidate and process reports from the field offices, and enhance the KU implementation design and accompanying tools based on evaluation results. The Pantawid Regional Field or Pilot Testing Team from Regional Program Management Office, Provincial Operation Office, and the City or Municipal Operation Office are designated body to operationalize the KU field testing as stated in their roles and functions as the pilot testing team member. For our closing, let me share this quote from John Holmes. "There is no exercise better for the heart than reaching down and lifting people up. Don't be tired of reaching down to lift people up. We can greatly contribute to uplift our household beneficiaries' level of well-being through our collective effort." Congratulations! We are about to finish the KU e-learning course program. Are we now excited about the last session? We need to be prepared to draft a plan for the regional KU pilot implementation for the finale. So tap the person's shoulder beside you and tell him or her congratulations and see you later for our coaching and mentoring session. Thank you for your active participation.